All right. So speaking of development, this is my son and myself. Pictures of us when we were still in development. Um, so guess which side am I? Which is why is that so obvious? Look, just the lazy eye, the kind of confused look, or what? So yeah, so yeah, less hair than my son. So all right, let's talk about stages, developmental stages in utero. Pre-embryonic stage, that's conception to 2 weeks. You get this solid sphere of cells is formed. You get eventually a cavity that opens in that sphere, and that's now called the blastocyst. Once that cavity opens, that implants in the endometrium. You get eventually an inner cell mass that develops, which becomes eventually what you call your embryonic disc. And then you get two cell layers, an ectoderm and an endoderm that develops in that disc initially. It divides into two cell layers, and eventually a third layer starts to develop between those, which becomes your mesoderm. Okay, so it makes kind of sense to have an ecto is outside, endo is inside, and the middle is the mesoderm. So that's just showing you this kind of process. Here's that blastocyst once it opens up, and then it starts out by having an ectoderm and endoderm, then eventually a mesoderm starts to develop. Well, this is still your ectoderm and endoderm, and the mesoderm will form in the middle here. So we don't have a mesoderm yet, okay? This right here, so this gets a little confusing, but this space developing on top, that's actually your amniotic sac. And then this big opening here, that's your yolk sac. And so if you this picture over here is showing you, this is the embryo itself, so that's this thing right here. Although what you're seeing in this picture is a sagittal, like the embryo is laying down like this, and you're seeing a sagittal side view of the embryo. And as the embryo develops, that amniotic sac starts to fully envelop the embryo, and the yolk sac starts to shrink, as the embryo is developing there. So in this picture right here, we're looking straight down on the top of this embryonic disc with this amniotic cavity or sac being cut off and looking straight down. You can see the kind of the red is the cut edge of that being pulled off. So it took me a while to kind of orient because your book doesn't tell you what these big openings are, and you're like, what is that? And so that's just your amniotic sac and yolk sac that we're going to kind of ignore. We're just going to focus on what's happening with this embryonic disc from this place, this moment out. So then we go to the embryonic stage, which starts at 2 weeks, so 2 to 8 weeks. This is where you start to get some differentiation. This is where the ectoderm becomes your sensory organs, epidermis, and nervous system. So key thing there, all of your nervous system comes from ectoderm. All of your actual neurons, peripheral and central neurons, sensory organs, all come from the ectoderm. Your mesoderm becomes the dermis, muscles, skeleton, and excretory and circulatory systems. Your dermis and muscles are innervated by neurons that are coming from the ectoderm. Okay, and then the endoderm becomes your gut, liver, pancreas, and respiratory system. Again, this is just showing you, here's this, fetus here, embryo at this point, and then here's that amniotic sac, and here's that yolk sac. And then you can see this is at a point where the neural pore or neural tube has started to close here a little bit, and then it'll start to zip rostrally and caudally, and we'll show you that. This is at 5 weeks. 8 weeks to birth would be fetal stage. So a lot happens in the first 8 weeks. It's a very critical period. That's, of course, a very common period for miscarriage and so forth, because there's these critical events happening during that phase, and that's why it's important for people to, especially during the 8 weeks, and knowing if you're pregnant, certainly can enhance things if you're able to, kind of make sure you're got the right, prenatal kind of things happening and vitamins and blah, blah, blah. But anyway. And so during the fetal stage, the nervous system just continues to develop more fully, and you start to get some myelination. Myelination doesn't actually end until you're like 3 to 5 years old. So, but myelination starts during the fetal stage. So let's talk specifically about the formation of the nervous system throughout this process here. So we're going to first start with just the development of the neural tube and brain. So neural tube formation, day 16 is when you initially get this differentiation of some of the cells in the mesoderm that are called the notochord. It rises from the axial mesoderm. There's just that longitudinal, in the mesoderm there's like a column of cells that start to change into this thing called the notochord. And it defines the longitudinal axis of the embryo. By 4 weeks, it's completely formed. Okay, so 1 month in, you got the notochord formed. It initiates the process of induction. Induction is where you start to pull kind of the ectoderm down into the mesoderm like this, and kind of pulls it down in and creates this, it kind of like you almost think of the notochord as a magnet for it to cause this induction. It directs the overlying ectoderm to form then the neural plate. This is what I thought this was very fascinating, interesting, is that your leftover notochord becomes your nucleus pulposus in your vertebral discs. As that little gel in the center of your vertebral disc, the nucleus pulposus, is leftover, was notochord, okay, and mature in vertebral disc. So now we're looking here. This would be the very top ridge of an embryo, kind of like we're doing a horizontal section through the embryo and looking at the top kind of ridge or back of the embryo here, okay, because the embryo would be, kind of like this if we continued it on. So here, this is all mesoderm in here, and this is that notochord that's developed in that mesoderm, that differentiation of cells called the notochord. That starts to get this thickening of the ectoderm and also starts to draw it in towards to start getting this neural groove here. And then it continues to kind of pull this in with it till eventually those touch and start to close the neural tube. And this is the process of induction you're seeing here. This is kind of interesting here, as you see there's a certain, this is called the neural crest. This is like the crest of where eventually those are going to touch there. And so those neural crest cells right there, these little red area, they start as ectoderm, right? And they are still but then they move into the mesoderm. But they started out as ectoderm. And this actually becomes your spinal ganglia, your dorsal root ganglion. Remember the cell bodies for our sensory nerves that lie just outside of our spinal cord? They came from those neural crest cells, which were from your ectoderm. So that's still ectoderm. It started out as ectoderm to help form those neural crest cells. And then those are going to be the cell bodies. The axons are going to grow out of those neural crest cells, and one's going to go over to the alar plate. It's going to be the proximal axon, and then the peripheral axon is going to go out to the dermis, the somite region of the dermis, to form create your dermatome. So this is day 16. Again, this is the start of that neural plate formation. So here's that first picture on the left is looking down on the top of the embryo developing, and then the other picture is a cross section through it, a horizontal section through it. And so this is the neural plate looking down on the top like this, and then this is that thickening right here that we're getting, a little bit of thickening, and eventually that notochord is going to form right there. Does that make sense? So the notochord will form in here during that first 4 weeks. Then the neural tube formation is happening kind of at the same time. This is once the notochord starts, a couple days later, the neural tube starts the induction process starts to take place, and it starts to take shape. The edges of the plate fold to create the neural groove. When the edges touch, day 21. Okay, I don't get too caught up in getting the exact days, but you got to be aware of the bigger kind of time frames, like what happens during the first few weeks versus the first month. but getting like day 21 versus day 22, I'm not going to ask a question that's going to try to trip you up because of like, when does the neural tube begin formation? Day 19, 20, 21, 22, 20, I'm not going to get into that. So it's not important to you as a physical therapist. Tube closes first in the cervical region. The first area to touch is up in the cervical region. Then it zips rostrally and caudally, okay, to close. Cells adjacent to the neural tube form those neural crest cells. These guys right here that we showed you, which become the dorsal root or spinal ganglion. The neural tube then moves inside of the embryo. It starts out on the ectoderm and the dorsal the plate there, and then it eventually gets enveloped. Once it closes, it moves inside the embryo completely. And then the superior neuropore closes at day 27. So about a month in is when that superior neuropore closes, which is where your cerebrum is. Okay, and then the inferior neuropore, right here down in your sacral area, closes 3 days later. So that first month is when those two, right around that end of the first month is when those two neural pores close. Okay. And then eventually that neural tube differentiates into two layers, into the mantle layer, which becomes the gray matter, and a marginal layer, which becomes the white matter. So here it is, looking down the top of the embryo, you can start to see, this is starting the process of developing the neural tube. There's a notochord in here that they don't show that's causing this induction. We get some thickening. We get the neural crest cells developing. We get the somites starting to develop in the mesoderm that are going to start lining up along the sides there. Eventually, we get a touching of that to close the neural tube. Happens in the cervical region. Then it starts to zip rostrally and caudally. Okay, here's our somites. Here's our now closed neural tube. Right now, all we're seeing is one layer of cells in there in that neural tube. But now, eventually, that one layer of cells develops into two layers, okay, two differentiated layers. That marginal around the margins, and then the mantle layer, kind of like. And so the mantle layer is going to become your gray matter, and the marginal layer is your white matter, okay, of the spinal cord. This is just showing an electron microscope, showing that same process in a chicken embryo with the process of induction, the thickening here. These are going to be your neural crest cells on the edge there. They're going to eventually move in. And then there's your closure of your neural tube. Your somites are going to be kind of in this region here, differentiation of the somites there. So, relationship of the neural tube to other developing structures. The mesoderm divides into spherical clusters called somites. Somites give rise to, we already talked about this, sclerotome, myotome, dermatome. The mantle layer, that's that gray matter, the mantle layer in there, cells are going to proliferate and further divide into a ventral or motor plate and a dorsal association or alar plate. The neural crest cells we've mentioned and how they form the spinal ganglion, but also the neural crest cells also form the peripheral sensory neurons, which are where the spinal ganglion are. And then they perform in the periphery, the myelin, the Schwann cells come from that. They also form your autonomic neurons that are going to go to your vessels and your organs and so forth, and endocrine organs. So those neural crest cells are pretty important. That's this blue stuff right here. It's going to form all of those. And they're going to break into segments too to correspond with the somite region areas. So here, if we take this neural tube, and then this is further in development. So, now we're just looking at, all we're looking at is this mantle layer. So all this was mantle layer right here. And that mantle layer divides into that association plate back here and the motor plate or basal plate right here. And so this is where your anterior horn cells are going to go to your myotome to supply skeletal muscles. And then your neural crest cells that were out here, they're going to create the cell body and sprout a proximal and peripheral axon to go to your dermatonal region of your skin and then back to the dorsal horn of the spinal cord. Make sense? Let's pause there. Any questions before I let you go for a quick break? Okay.